Overdosing on medications in the home is a common means by which kids attempt suicide.
Medications are a leading contributor to suicides across the country. In August, the Doernbecher Children's Hospital saw a rise in youth suicidal thoughts compared to last August.
Even before the pandemic, we were seeing an increase in crisis, but it was exacerbated by the pandemic.
Kyle Johnson is a professor in the Division of Child and Adolescent Psychiatry at OHSU. They've been tracking this ongoing trend since 2015. And while suicidal thoughts are on the rise among youth, Johnson says suicide attempts have stayed consistent. And of those attempts in August, 91% of cases did so by medication overdoses.
Yeah, the acute phase of a suicidal crisis is often short-lived. So if we can obstruct that suicidal impulse in some way, we can save lives. And a medication lockbox is a means to do that.
Lines for Life Oregon is one of the many nonprofits trying to help. In the first year of the Suicidal Crisis Lifeline 988 launching, Lines for Life has answered over 40,000 calls and 10,000 texts total from those in a mental health crisis. And more are coming in from youth as the school year is starting back up.
And this is what we hear from some of our contacts, is that the transition from the summer to the school year can be incredibly challenging. There's a lot of changes and a lot of growth and a lot of uncertainty that goes with getting back in school.
Just like Johnson, Emily Moser with Lines for Life says having easy access to pills plays a huge part in this ongoing crisis.
These are the things that we hear, that the pills are, I have the pills right here. Or I can get them in my mother's or my family's cabinet.
Having a safe place to store and lock medication with at-risk youth at home is encouraged. OHSU has launched a program giving away lock boxes for families who visit their facility to use at home.